Hello, good morning, everyone. This is Dr. Eric Bricker, and thank you for watching A Healthcare Z. Today's topic is stories required for healthcare sales. Now, as always, those of you who are watching live on LinkedIn and YouTube, if you could please leave a comment to say that you can see and hear me okay. I just want to confirm that the connection is working out. And then two, of course, during the presentation, the comments and questions that you put in on LinkedIn and YouTube, I can see on my end. And so I want to make this interactive. So please put in your questions and comments, and I will answer them over the course of the presentation. And if I don't answer them during the presentation, then I will answer them in writing afterwards. Now, one more request is that if you could give this video a thumbs up or a like, that would be super helpful. So if that's all thing that I could ask, that's great. Now, as always, many of you know who I am, but for those of you who do not, I'm Dr. Eric Bricker. I'm an internist. I was a hospital finance consultant before going to medical school, back in the billing and business office of major medical centers like the Cleveland Clinic. Then I went on to medical school at the University of Illinois, then did my internal medicine residency at Johns Hopkins in Baltimore. And then I worked as a hospitalist physician at the Baylor Plano Hospital outside of Dallas. While I was in residency and while I was practicing, I actually started a healthcare navigation firm called Compass Professional Health Services that sold our advocacy and navigation concierge services to employers to support their employees and their families, to 2,000 employers, 1.8 million employees, and we did it for 11 years. And so a lot of what I know about healthcare is from helping 1.8 million people navigate the U.S. healthcare system and health insurance for 11 years. And you'll learn a thing or two when you do that. And we ourselves had over 300 employees. And so we just had gobs of fantastic opportunities to learn about all the challenges and how to fix them on the individual level. Okay, then that company was acquired by Alight Solutions in 2018. I started making all these A Healthcare Z videos to continue to educate the public about healthcare finance so that in case I get hit by a bus, other people will know this stuff as well. And now I'm also the medical director for an alternative health plan called Simple Pay Health. Now, with that, let's talk about stories and sales. And this is not specifically about healthcare sales. This should really be entitled How to Persuade in Healthcare. Because even if you don't have a title of quote unquote sales or marketing, we all need to persuade others in our jobs, whether we have a financial position, whether we have an operations position, whether we have a customer service position, you name it, we all need to be able to persuade. If we're in any sort of leadership position, leaders are persuaders. You have to be able to persuade. And so, of course, if we are going to bring change within healthcare in terms of helping patients, lower cost, helping doctors and nurses, then we need to be able to persuade others because the status quo today is not okay. And so we need to persuade for change. Okay, so let's talk. So I was thinking about, okay, let's say all of you are educated about all these various solutions for change within healthcare, but this needs to be very practical in terms of how that change is then implemented. So this talk is about the successful implementation of change, and the successful implementation of change within healthcare requires stories. The successful implementation of change within healthcare requires stories, and it requires stories because decisions are emotionally driven. So the Harvard Business article, you can see the link there. 95% of our purchase decisions take place unconsciously and are emotionally driven. Now, every single one of you on this presentation, myself included, are like, that's wrong, that's false. I make decisions because they're smart. I don't make decisions because they're emotional. I make smart decisions. So how is it possible? How is it possible that 95% of our decisions are emotional, and yet we think our decisions are made because we are smart or because we have quote unquote good judgment? It's because our conscious mind, this is point number 2, also from the Harvard Business Review article, our conscious mind will always make up reasons to justify unconscious decisions. In other words, we rationalize. In other words, we tell ourselves rational lies. We lie to ourselves. Well, we don't intentionally lie to ourselves. We just do it. It's just part of the human condition. It's human nature. We say, oh, this is the reason why we're doing something, when in fact, that is not the reason why we're doing something. We're doing it for something else. It's the old adage, you've probably heard this expression, there's typically 2 reasons. There's the reason that sounds good, and then there's the real reason. Okay, the reason that sounds good is the quote unquote smartness of the decision. The reason that is the real reason is the emotional reason for the decision. Okay, so what are some examples of emotional reasons? The classic ones: fear and greed. Okay, so when I worked at Compass and I was working with the HR leaders, they would even tell me occasionally that much of their decision making around whether it was Compass or their health insurance carrier or what have you was around job security. That was the main driver of their decisions. They're like, I'm making these decisions because I want to keep my job and not get fired. Not because they were trying to improve the health of their employee population, not because they were trying to lower healthcare costs, but specifically out of fear because they didn't want to get fired. Now, I'm not judging them for that. The people who told me that were actually great to be so honest with me. I mean, they were incredibly self-aware to actually be like, well, it might sound good to say that I'm like saving the company money, or it might sound good to say that I'm helping the employees, but the real reasons is like, I don't want to get fired. Okay, so what does this have to do with stories? Stories engage our emotions. So if decision-making is emotionally driven, the keys to those emotions are stories. Okay, also from the same Harvard Business Review article. Story, interestingly, and this is biologically based. Okay, stories activate regions of our brain that process sights, sounds, taste, and movement. We literally in our brain create a movie of what the story is about. It creates essentially a virtual experience in our brain. And when we have that virtual experience in our brain, then we can experience the emotions associated with that experience. Every single one of us has watched a literal movie and has been emotionally moved by that movie. When I was a kid growing up, the first movie that I was like totally choked up in was E.T. Like, so the point is that when you hear a story, you're playing E.T. in your brain and you're feeling the emotions of E.T. in your body as well. So let's talk about some stats related to the power of stories in sales. Leads that love a sales story are 55% more likely to buy in the future. Stories are statistically proven to improve your success rate in persuasion or sales. Okay, 44% of leads that love a sales story are more likely to share the story. That's the great thing about stories, is that because they engage the sights and the sounds and the taste and the movement sensors in our brain, they are much more memorable. We remember stories much better than we remember facts. For example, when this webinar is done, the vast majority of you, me included, will not remember the fact that 55% of leads that love stories will be more likely to buy in the future because it's not a story. It's just a fact. So the fact that it is a story makes it much more memorable. And when you remember something, obviously you can then share it. If you forget something, it's impossible for you to share it. Okay. So now, of course, I got to tell you a story about stories. Okay. So this is where in business, we always have euphemisms, right? So we never say story. That sounds too colloquial. We have to dress it up with something more that sounds more intelligent, that sort of justifies the salary that we're getting paid. So we have to say things like case study. What's a case study? It's a story, okay? So just know you could use the word example, right? So there's a million euphemisms for a story. You could call it a parable, okay? There's a million euphemisms for a story, but it's just a story. So let me tell you the story of Lydia. Lydia is an actual person. So she's a 51-year-old female that I used to work for, who's a salesperson for a digital health company. And I would do tons of sales presentations along with Lydia. And she averaged about 3 to 5 stories per 30-minute sales presentation. I also worked with a lot of Lydia's colleagues who were the other salespeople at this sales organization. And these folks, when I wrote 1 to 2 here, I think the more accurate description is actually probably 0 to 1. Her colleagues only told like 0 to 1 story during their sales presentation. Okay. Same product, same value proposition, same outcome. They were largely selling to the same types of customers. It's not that like Lydia had like better leads than the other people. I would argue that their leads were all equivalent. Lydia was number 1 in sales. She sold $1.2 million in annual recurring revenue in 1 year, which if you just say that the average lifespan of a customer was 5 years, then she sold the equivalent of $6 million in sales in 1 year, which was 3 times more than her colleagues. I mean, it was astounding how successful Lydia was. Okay. Now, here's the punchline of the story. Lydia, speech pathologist, not like a professionally trained salesperson, didn't have a big background in sales. And this is especially helpful in healthcare because healthcare is complicated. It is. Okay. So I have seen tremendously successful salespeople who had a background in the sort of nuts and bolts of healthcare delivery, who then moved into sales, and they were highly successful salespeople because they could take the credibility and their experience and the stories from all of their healthcare interactions and then use them in sales. So they essentially could learn the sales part of it. So people say, are salespeople born or are they made? And the answer is it's both. Okay. You can absolutely make a salesperson. Okay. Next up, case study number 2 of Omar. Again, Omar, an actual person that I know and worked with, 49-year-old male salesperson for a different digital health company. He is such an amazing storyteller. He would tell an incredibly diverse types of stories during the sales process. And he was selling to employers and brokers and benefits consultants and for employer-sponsored health plans. He would use his own personal story. He would use the stories of other employer clients. He would use the stories of specific HR leaders. And then he would use stories of the specific plan members that use the digital health solution. So notice that it was a variety of stories for a variety of beneficiaries of the change, right? And in healthcare, there's lots of different participants. And so for Omar to understand that there were lots of different participants that could then benefit from the solution. And the fact that he could tell stories that were very specific about how each one of those different participants benefited from that digital health solution was incredibly successful. It was so successful that Omar was given equity in a subsidiary of the company that he worked for. He was made a part owner. The parent company then spun out and sold that subsidiary that Omar had equity in, and Omar made millions of dollars. Omar made more from this equity and this sale of this subsidiary than he ever made from commissions from his sales. So here is another example of stories directly translating into the personal success of the storyteller. Now, so you're like, okay, Dr. Bricker, this is fascinating. Like, what are some practical things that we can use to be better storytellers? Okay, when you tell a story, show your face and smile. Holy moly. I guarantee you that, and this is why in-person and video is so superior to phone, or probably the worst cardinal sin is to have like a Zoom or whatever, WebEx or Teams or whatever, and to not turn your video on. Like, our brains are hardwired to be attracted and engaged to human faces. The human face itself is the most effective engagement tool, okay? Do not, when you're doing this, just do slides. Why do you think I show my face next to these slides and not just the slide? It's because faces are infinitely more engaging than the slides themselves, okay? And, everybody knows you have to know the know, like, trust, okay? So you have to know somebody, and then you have to like them, and it's after you know and you like them, then you trust them. And it's the trust that is so crucial in the sale, okay? So it's much easier to like somebody who smiles than to like somebody who doesn't smile, okay? Listen, I do not feel like smiling all the time. The vast majority of the time, I do not feel like smiling. But if you're in business, you're in show business, okay? Every one of us, when we go to work, we are on stage. And guess what? Performers on Broadway, they have bad days. They've been up all night with a crying baby. But when they get on stage to do like Phantom of the Opera, it doesn't matter because they're on stage performing. And when we go to work, it's the same way. Okay, next, keep it short. These stories do not have to be super long. Lydia, when she would tell stories, like, her stories would be like 30 seconds. So don't feel like you've got to like create some sort of like, Lion King-esque complex story like Hamlet, okay? Like, just keep it short. Like, that's okay, all right? You don't even have to call it a story. You say, look, it's just an example, okay? Next up, you got to use enthusiasm, okay? No limp noodles. If you're going to you got to throw strikes. You got to throw the ball hard, okay? So in tennis, it's called a pusher. Somebody who just hits the ball over the net super soft. They're not successful, okay? You got to hit the ball over the net hard, okay? So you got to have enthusiasm. Again, just like those actors and actresses doing Phantom of the Opera or Les Miserables, like, they are enthusiastic about whatever it is that they're doing on stage. We got to be the same way when we don't necessarily feel that way. So listen, many, many days, I'm like, I don't really feel like it today. Like, that happens more commonly than it does not. Okay. Now, next up, using customer testimonials is also fantastic. Okay. So the stories of the customers themselves are oftentimes better than our stories. So to the extent that you can leverage their own customer testimonies and in their own words, it's fantastic. Okay. Next, Make sure the stories are true. I remember when I was a doctor in the hospital, I would always ask people what they did. And I had a lot of elderly patients that were retired. And one of the elderly patients was a retired salesperson. And I was just starting to do my sales stuff at Compass, and I was flubbing it up dramatically. And so I said to him, okay, what's the most important thing about sales? This guy was in his like early 80s. You know, he'd been a sales guy for like 40 years, retired. And guess what he said to me? Don't lie. I said, wow, that's profound. Don't lie. Don't make something up. Okay, so how do we get true stories when we just don't know? If you're actually in sales, talk to operations and account managers within your companies and get stories from them. I guarantee you that the operations people and account managers people have fantastic stories of success for your company and your organization. They do not, and here's what I thought, where I was totally wrong. I'm like, oh, if they hear a fantastic story, they'll go out of their way to share it. Guess what? They don't. They do not. They just go about their business. And I would talk to these account managers, and I would talk to our Compass Health Pros, and they would have these amazing stories. And I'm like, did you tell anybody about this? And they're like, no. And I'm like, why? And they're like, because no one ever asked. So you have to ask these people to like tell you stories, and they will tell you the most amazing stories of amazing stuff happening within your organization. So you got to go searching, seek and you shall find. You got to go searching for these stories, and I guarantee you will find them so you can tell true stories. Everybody loves a true story. Truth is better than fiction. Okay. Now, what else are you going to do? You're going to do multiple stories. It's like a commercial, right? You can't just have one commercial during the Super Bowl and think that that's going to increase your sales. You have to have gobs of commercials over time. So you do have to do repeated small stories. You have to weave them into the conversation. So it's not like, okay, halfway into the presentation, now I'm going to do story time. No, that's not how it is. You weave it in to the conversation. Okay. Now, what are some resources for storytelling? Okay, everything I'm telling you about stories, I didn't know. I didn't make up myself. I learned it from other people. And I in no way am saying that stories alone are sufficient. Okay, they're necessary, but they're not sufficient, right? So like wheels on a car are necessary, but they're not sufficient. You have to have an engine as well, along with a steering wheel and a whole bunch of other stuff. Okay. So they're necessary, but they're not sufficient. Okay. In healthcare, for the vast majority of times, we are dealing with what is referred to as a complex business to business sale. In my opinion, the best book ever written about the complex business to business sale is Hope is Not a Strategy, from Rick Page, who was a sales trainer and a salesperson for Dun & Bradstreet. Now, Dun & Bradstreet sells a whole bunch of like business intelligence and market like data to businesses. Okay, like Dun & Bradstreet's product is excruciatingly boring. Okay, guess what? Much of what we do in healthcare and health insurance is actually really boring. So one of the other famous sayings in insurance is that insurance is never bought, it's sold. So if you're selling a really boring idea or a really boring product like he was selling at Dun & Bradstreet, then you got to be really good at the complex business to business sale. And I will tell you, at my 11 years at Compass, all of the aspects of what happened in the Hope is Not a Strategy book, like they totally happened in real life. Like I would go back and I would look at what I had underlined in this book, and I'm like, holy moly, that just happened last week. Okay. Next, one of the best ways to learn how to tell stories is to watch other people tell good stories. One of the best storytellers I've ever seen is a gentleman by the name of Jim Rohn. And Jim Rohn, unfortunately, has passed away. I think he died in 2012, but he has a lot of videos on YouTube. Jim Rohn was a sales guy. Jim Rohn was Tony Robbins' mentor. I would say everything Tony Robbins does and knows, he learned from Jim Rohn. Jim Rohn was like the Tony Robbins of the 70s, but we didn't have the internet. So he was sort of this, and he was incredibly popular in California, in Southern California, where he lived. But he wasn't as well known as Tony Robbins because it just was a different age. But his stories are amazing. So just go onto YouTube and watch some Jim Rohn stories and listen to how he tells them and listen to how he talks, which, by the way, is another story for another day. But Jim Rohn's mentor was this guy named Earl Shoaff. And Earl Shoaff was the mentor to not only Jim Rohn, but he was the mentor to Mary Kay Ash, who started Mary Kay Cosmetics, one of the most successful businesswomen in American history. And Earl Shoaff was also the mentor to Zig Ziglar, probably the most successful insurance salesman in all of American history. So Earl Shoaff knew a thing or two. And he taught Jim Rohn, who then taught Tony Robbins. Now, my own mentor was this guy named Brad. Again, he sold an incredibly boring product. He sold IVR systems. So the voice response system, like when you call American Airlines to like change your flight, and the computer says, tell me what you'd like to do. Change a flight. And then the computer says, I think you said change a flight. So he would sell that to companies. That's a complex business-to-business sale of an incredibly boring product, okay? Brad, hugely successful, gobs of money, okay? Like, I would go to lunch with Brad like maybe 3 or 4 times a year, and because he knew one of the other founders of our company, and Brad was super helpful. And, anyway, the point is that you have to learn from other people. One of the things that Brad told me was, look, buyers are liars, okay? And so what does that mean? They tell you they're going to buy and then they don't. Okay, that doesn't mean they really lie. I mean, it's just they change their mind and blah, blah, blah. But the point is that he taught me that persuasion is actually an exercise in constant failure. So you just have to keep at it. And you just need to expect failure. Like anytime we work to persuade, anytime we work to tell stories, like just know that like the story is not going to work the majority of the time, but like that's to be expected. Again, that doesn't mean that you don't tell the stories. You just have to keep at it. Okay, next up, take home points as we finish up the 30 minutes here. 1, any organization with a great value proposition that is poorly sold with no stories, it will fail. Conversely, just a so-so, I would say even mediocre value proposition, like their widget or their service, like isn't that great? But if it is sold with frequent, concise, passionately delivered stories, it will win. So what does that mean for all of us, especially if we're involved in sales? If we can't get change, if like we're not having success within our organization, being able to convince people or persuade people, or if it's outside of our organization and we're trying to actually sell to them, then we need to change the way that we sell before we change the value proposition. Salespeople are notorious for going back to the product people and the operations people and be like, oh, we got to change this and we got to change that and blah, blah, blah. And it's like, anytime you point your finger at somebody else, you got 3 fingers pointing back at yourself. Okay, we need to take ownership of what we have control of, and we need to change our stories and the way we persuade before we go to the operations people and the product people and start doing our yada yadas about how the product or the service needs to be different. Okay, so with that, let me go to some of the questions and the comments here. Again, if you'd like to connect with me on LinkedIn, please do. Then my videos will show up on your feed. I'd love for you to do that. If you would like a copy of these slides, please email me at ericb@ahealthcarez.com. If you would like to join my email list with over 3,700 other healthcare leaders, also just email me at ericb@ahealthcarez.com, and you will get the videos emailed to you so that if you're not looking at LinkedIn or whatever, that you can still not miss anything. Okay. Lee makes a very good point here. He says, hence the snake oil salesman moves their magic past reason. That's right. Snake oil salesmen always have existed. They always will exist because of that ability to emotionally drive a decision. Richard says, ego and economics are central to decision making. Absolutely true. All right, lots of good more. I was scrolling back. Lots of good mornings. Thank you for those. Chad says, logic brings us to the table, but emotions make us sign. Absolutely true. Rebecca says, always lead with your why through great storytelling to connect with your audience. Kathleen liked my no limp noodles quote. Okay, fair enough. Thank you for the feedback. And then Lee asks a question here. Should a story be standalone or accompany data, like a graphical image? So, Lee, that's a great question. And the answer is it depends. So there are certainly situations where incorporating numbers in your stories is very helpful. So I would argue that the synergy between stats and stories is even more powerful. You know, one of the other sort of classic sayings is that you use numbers to sell, because it gives it allows the listener to attach their rational brain to the emotion, right? So again, you are using emotion to sell, but you're giving them the rational explanation for why they're feeling the way that they feel. So you're essentially doing both for them, which is very helpful. Now, Ravi, and this will be the last question I address. So thank you and for everybody for coming and for watching. Ravi asks, when will real healthcare change happen? So Ravi, it's a great question. I would say that we have already had real healthcare change, and it has been in the wrong direction. Yes, there has been change. Isn't that interesting? There has been change, but it's been in the wrong direction. And so, frankly, a lot of the strategies that are used to move healthcare in the wrong direction need to be used to move healthcare in the right direction. You got to fight fire with fire. And so actually the people and the organizations that are moving healthcare in a way that is against patients, we need to learn from them. And so believe me, do the people who are increasing healthcare costs and not addressing major deficiencies in patient care, are they using stories to move in the direction converse to what we are trying to do? The answer is absolutely. So let's fight fire with fire. And with that, I want to thank you all for attending, and I want to thank you all for being the wonderful people that you are and moving the ball down the field for improvement of healthcare. And with that, have a fantastic Friday and a great weekend. Bye now.